UroFill short, and this one specifically addresses quote unquote migration versus force related movement. Let me make some definitions here. So migration of a subdermal injection of hyaluronic acid does not occur. In other words, migration to lungs, migration to areas, unless the material is injected intravascularly. So migration in the hands of somebody that's experienced, especially for this penile girth enhancement, you're not going to have any migration to places that you don't want it, because the technique is designed to avoid these vascular spaces that can lead to migration. Now, there is a phenomenon which is force-related movement of this material. And for example, your first round of UroFill, you end up being allowed to have sex, say 3 days later. And when you come in the following week for your modeling, there may be some movement related to that sexual act. You also may have some movement related to just the tumescence and detumescence that occurs at least 10 times in a healthy penis during the evening. But this movement is localized to the area that we're building. And once we build those columns, which is the patented technique, building the columns at 3 and 9 o'clock along the penis, once we build those columns, then it sits in and it stabilizes the material. So because this technique is a process, you just got to be a little bit patient, because this force-related movement goes away once we built those columns adequately. So don't worry about migration, just worry about making sure that you have somebody build those columns correctly.